Hi there, and welcome back. So we are moving on with our emotion regulation module, and this again is DBT for persons with FND. So we're modifying and adapting dialectical behavior therapy skills for those of you that have functional neurological illnesses. And so we are on to the part of emotion regulation where we are learning skills that can actually change our responses, our emotional responses when they're unwanted. So last week we talked about using checking the facts to do that. And again, this is all after understanding, becoming aware, and naming emotions. But this is once you become aware of them, you know what you're feeling. What do you do if something is unwanted? So if you've checked the facts and your emotions are still problematic and unwanted, then you've got two other strategies to think about. One of them is opposite action, and the other one is problem solving. And we're going to talk about problem solving in a lot of depth next week. And so today we're just going to talk about the option of problem solving. And so this handout here, um, handout 9, gives a good example about if you're trying to decide which tools to use. And the first square here is identifying your emotion and then saying, does this emotion actually fit the facts? And you check the facts. So let's say you check the facts, and yes, it fits the facts. You are going to, let's say, a wedding, and you are having FND symptoms several times a day. And this is a 6-hour wedding. And so you know you will be facing some symptoms and some uh, possible people witnessing these, maybe misunderstanding, not thinking they're a medical emergency. It might be cause some distress and fear about how people are going to handle it, or even some shame that you might be judged or excluded because of it. Um, and so you can ask yourself, is acting on this emotion, if you're having fear and shame, you might not want to go to this wedding, or you might want to avoid the wedding and to make sure that you're not judged or that harmful consequences don't happen or it's not too disrupting to the other people in the group. And so um, then you can ask, is acting on that emotion effective? Well, if it is, let's say you've really checked in with your wise mind and you've determined, yeah, this is going to be too disruptive, and I need to uh, actually bow out, and the people there aren't going to understand. It's going to be too disruptive. I'm not going to go to the wedding. So that would be this far end here. You want to be mindful of your emotions of maybe fear and shame and act on that emotion. And then also problem solve. Like you've got a problem here. You've got the FND symptoms. Maybe they need to be addressed. You need to get different treatments or change your treatments or just continue to do the treatments that you're doing. Maybe you need to educate the people in your life about it, or maybe there's some way to have weddings that are more inclusive of people that have medical illnesses. So there might be problems that are involved with this scenario that need to be solved, and we'll talk about that next week. But let's say that this is like your own child's wedding and you just cannot skip this. Like it would be harmful not to go, even though you're quite frightened, even though you're feeling afraid, you're feeling maybe even a shame that people will judge you, but you know that the people there that you love want you to be there. You know this is a once in a lifetime um, experience and that you just have to be there. This is one of the big things in life, and that, your children would never excuse you from it. So you would then maybe, even though it fit the facts to have those emotions, you might need to decrease those emotions and not act on that and actually go to the wedding. So in that case, you would practice opposite action, and we're going to talk about that. So this is where you're going to go to the wedding anyway, even though your urge is not to go to the wedding. So that's the left-hand side of this whole algorithm. But let's say you went to the top here and you were checking the facts, and the facts did not, it didn't fit the facts. You've never had symptoms. Let's say you're feeling afraid of going to a wedding and feeling some shame that people are going to judge you. But let's say nobody let's say that you have symptoms so rarely, once a year, or let's say your symptoms are so socially imperceivable that no one would notice them, or maybe everyone there knows, and there is no fear. It's not going to be disruptive, but there are facts that don't make it a threatening place to be, or nothing fearful, or that would be blocking your goals and no one would be judging you. Nothing like that would happen there. Then it would not fit the facts to feel afraid or shameful about your symptoms before this wedding. So you would go down the no side of this algorithm and then ask, well, is acting on that emotion effective? So check in with wise mind. So probably not, especially if it didn't fit the facts. Then you're going to need to go to the wedding. If you want to feel better and not feel that shame and that fear, then you would want to go and do opposite action so you could decrease those emotions and feel more comfortable. So you would do opposite action. I know we haven't talked about opposite action yet, but we're going to get to that. But let's say that you felt afraid and but it was when you checked in with wise mind, it wasn't a good idea to go to the wedding. Maybe there's some other thing going on and there's some reason you shouldn't go to the wedding. Let's say like there's some exes or bad blood with some other people, or there's some really good reasons not to go to this wedding. But it has nothing to do with your symptoms. But maybe it's a good idea not to go to this wedding for some reason. Then you don't have to act. Then you could just act on it, even though it doesn't fit the facts. It still might be effective to avoid going to this wedding for a whole myriad of other reasons. And that would be what's on the right side. But you could consider it again and check in with yourself and maybe reconsider opposite action. So I'm hoping that delineates a little bit about how these skills work. But again, we haven't talked about how to actually do opposite action or problem solving yet. So we are going to start with opposite action here, how to do it. Oh, and before we do, I do want to just check in and just talk about how opposite action might be pretty helpful for FND related issues. I gave the example of the wedding, but opposite action can really be helpful for counteracting patterns of avoidance and safety behaviors that some people with FND um, suffer with, which is totally reasonable because of trying to adapt to your environment with these symptoms. But then, unfortunately, when you avoid or do safety behaviors, sometimes that can actually increase the chances of you having FND symptoms and also increase your anxiety and fear about them. So it's opposite action is really good for those safety and avoidance patterns that develop as a result of getting FND. Um, and yeah, so these handouts are really going to highlight these action urges that you might face as far as anxiety and fear, and help you lead less restrictive lifestyles, decrease your anxiety, and have a better mood. be able to engage in more pleasant activities, because often avoidance behaviors, you start to limit your pleasant and mastery activities, and then you can really be at risk for depression and mood disorders. So we think that opposite action is quite important for improving one's mood. And we also think, you know, that if you can practice opportunities to kind of stretch your limits and get confidence, that can be quite helpful. And also, if you're, yeah, just decreasing any of the reinforcing behaviors that can happen if you're needing reassurance constantly from providers that maybe one of your symptoms is not a deadly illness or not part of a deadly um, or not something that needs to be diagnosed or cared for, and then you don't engage in um, going to the hospital or asking 100 questions to see if your symptoms are something other than FND. Sometimes that can also help reduce some of that anxiety. But on the other end, as I said, people can also overuse the healthcare system when they have FND, but then they can also underutilize it and then maybe not go to the hospital or not check out with their doctors when they're having new symptoms because they're afraid they're going to be invalidated, or they're afraid like, oh, I'm just making this up in my head again. And afraid to like really check the facts. So opposite action can help you just do effective healthcare rather than doing your healthcare in response to emotions that have to do with avoidance and safety behaviors. Um, and let's see, thinking of some other ones, but we'll come back to this. So, yeah, and it might be important as you're often FND can kind of really change your whole way of being in the world, and you have different limits, different activities you have to do. And so there's a lot of new things that can be scary and awkward and do require doing opposite action until they feel normal or feel comfortable to you, and the emotions that go with doing novel things can be distressing. And so doing opposite action can help you regulate those emotions as you learn new behaviors. So, going back to our how exactly do you do this? We have it all written down in a recipe here. So, opposite action, basically, you want to remember, is acting opposite to the emotional urge to do or say something. So you want to do it because it's an effective way to reduce unwanted emotions when your emotions don't fit the facts. And um, as I said, behavioral activation is actually a way of doing opposite action of avoidance behavior and opposite of isolating and ruminating. So it helps your mood. It can be part of exposure-based treatments. So many people with FND have comorbid anxiety disorders like post-traumatic stress disorder, complex trauma, panic disorder, simple phobias. All of those things require exposure-based treatment. So really, exposure-based treatments are opposite action treatments. And effective treatments for anger and stress, learning to identify the cues of frustration and then leaving the situation to cool down, maybe rather than attacking or doing something, and inhibiting your impulses rather than uh, uh, just letting them go. Or sometimes it can be you're over modulating or you're inhibiting too much and you're over controlling your emotions and you need to just let them out. And that might take some bravery just to let yourself express emotions you've never expressed before, or say something you've never done, or be assertive. So when opposite action works best, when knowing the facts about a situation doesn't work, that's when it really works well. When knowing the facts, then that can be really effective. Two, when emotions are not justified by the situation. So when your emotion or its strength or its length of time it's lasting is not justified by the situation, opposite action can be effective. So problem solving is needed when the emotion is justified by the situation. So emotions are not justified when they do not fit the facts of the actual situation. It's not that they're not valid. So the term justify, don't get too concerned that, or I'm hoping you won't take it to mean that they're not valid. Like every emotional response is valid. It makes sense from the history and where you came from, that any emotion that shows up, it's there for a reason. It's not justified when it's not effective and it's not helping you. Um, so, uh, you know, if you uh, went to your office, for example, and there was a snake in your office, and a poisonous snake, you would be afraid and you'd run out of there, and then but to be effective, you might have to problem solve and like get somebody, urban wildlife management to come in and take the snake out of there eventually, right? So you have to problem solve that emotion. But let's say you go back to your office and you're still feeling scared, even though the snake's not there. The likelihood of having another snake is never going to be the case, but you have to do opposite action and just keep going to your office until the fear goes away from that individual event. Um, but let's say that your emotion was so high that you could not actually, if you are when your emotion or the intensity is not effective for meeting, your goals, or when the emotion or its strength, or the length of time it lasts is not effective in meeting your goals, then it may fit the facts well, but experiencing and expressing that emotion may do you little good, and cause you harm. So let's say that you saw that snake in your office and you got so freaked out you couldn't calm down, and you couldn't calm down enough to call the urban wildlife management to get the snake out of there. You couldn't go back to work, and it went on and on. It interfered with your problem solving. It interfered with your being able to do the opposite action to get comfortable with your office again. Then even though it might be justified that you had a snake in your office to be afraid, it's not being effective. And so you have to work on not just the emotion, you have to turn your emotion down um, enough to be able to call the pest control people to get the snake out of your office. So anyway, hope these, I know they're kind of silly examples, but I'm just kind of bringing home the point, and you can apply it to your life and your own emotions and problems in different ways. So yeah, same thing I can see. I know with many of my clients, you might have a sensory symptom. Let's say you've got some numbness in one part of your arm. Um, well, it might be reasonable to have a little bit of concern and a fear about that, enough to maybe make a doctor's appointment if this is a new symptom to go take a look at it. But if you were, you know, not able to sleep for days and weeks before the hospital appointment, and were so afraid you're going to the emergency room just to get reassurance, then that intensity and the duration of the emotion is not helping you. It'd be better if you were just like rather than an 8 out of 10 and worrying and not being able to sleep, you were a 3 out of 10 and could just wait till your appointment and they could take a look at this issue. So that might be an example of how it could be applied to FND. Um, so when you're avoiding what needs to be done, sometimes the issue is not really whether an emotion fits the facts, but rather whether acting on the urges has the outcome of avoiding doing things that you need to do. If you find that you're avoiding doing something for this reason, opposite action can be very helpful. So let's say you're very depressed and want to stay in bed all day. You want to isolate and avoid everyone and everything, getting up and active and engaging with people rather than avoiding them, however, are really necessary to reduce depression. Or let's say you're so anxious that you don't want to engage in treatment that will reduce your anxiety. Acting on your urge to avoid, however, will lead to more anxiety and not getting better. So, um, if you're decided you're going to try opposite action, um, here are the steps you would take. Uh, and and we've got it here in this how to do opposite action 7-step method here. So, number one, identify and name the emotion you want to change. Number two, so you can look through the worksheets. For number one, you can look through your worksheets for A, look at the common emotions, and then fill out the name and rate the intensity. And then you want to check the facts. And that can be difficult to figure out in case you've misinterpreted a situation or missed important facts. Does the emotion fit the facts of the situation? You want to ask yourself that. If the emotion is reasonable response given the situation, is it justified by the facts? And the last two in the list, the major events that ordinarily justify specific emotions are in your handouts. And you can also use Emotion Regulation Worksheet 5 to check the facts if necessary. So then you go to number 3, which is identify and describe your action urges. So pay attention to your impulses, your desires, your cravings. What are you feeling like doing? What do you want to say? And then ask your wise mind, is expressing or doing those things, acting on that emotion effective in this situation? So you could go back to your mindfulness. Often when you're in a more relaxed state, that can really help you determine that if that's possible for you to do. And act opposite of the emotion. So if your wise mind says yes, the answer is yes. It's acting the opposite would be effective in this situation, and that expressing this is not effective. Then you go to number 5, which is act the opposite of the emotional urge. If you've gotten this far in the process, you probably decided that your emotion is not justified by the facts or by your goals, and meaning the emotion isn't effective for your goals. So you should do the opposite of what your urge is. And you can also look over the emotion regulation handouts that will go over 11 and 13 for ideas of possible opposite action if you're unsure. So do the opposite action of your actual action urge, and do it and just do it. Do not blindly follow the actions in handout 11 and 13. The reason for this is that opposite action in these handouts assume the emotions are relatively straightforward and have universal identifiable common action urges. But emotions, we know, are very much more complex. They're individual. They may be a blend of different emotions occurring at the same time. An expression and action urges may be unique to that blended emotion. So even when an emotion is simple and easy to identify, its action urge may be unique to you or your culture or your community or your group or your lived experience. And then let opposite action do the work. Do not suppress the emotion. You don't need to control it or anything. Just let your behaviors do that for you. Don't try to suppress your emotional experience or feelings. If you try to suppress emotion while doing opposite action, then you're not letting the strategy actually work. It's the behavior. It's not your willpower doing it. If you experience the emotion all the while you keeping your ears and eyes and senses open, then you'll learn in a fundamental way that indeed the emotion is not justified. Your brain gets the information encoded that you will find your emotional reaction going down, down over time. That incongruence between what you predict to happen and what's actually happening that actually changes the brain and decreases that emotion. So opposite action is a strategy that works over time to reduce your unwanted emotional reactions. And if it does not seem to be working, give it time. And then you want to do it all the way. When you do opposite action, do it all the way. This means opposite posture, your face, you're expressing your thinking. I was like fake it till you make it is a kind of mantra I like to say to myself. But halfway opposite action usually does not work. It's important to do on every part of your response to make sure that your opposite action is done all the way. There may be little tiny micro behaviors you're not aware of. So if it's not working, think about adding even more. Um, Going to a party to try to reduce your social phobia, but spending your time looking down and standing in a corner is only halfway opposite action. Acting kind and sweet to reduce anger or disgust, but thinking you're a jerk, how disgusting, is halfway opposite action as well. So you want to also have your facial expressions and your voice tone and posture, be an actor or an actress, like really just get into it and fake, you fake, fake, fake. You're faking how you feel and you're acting the opposite. And but you're not suppressing, you're doing it with intention. So you're not pretending, but you're doing it as a strategy. And as you can see from the examples, like changing your thinking and your emotional expressions without changing your emotional actions very rarely works. The central aspect of skills are figuring out what emotional action urge is, figuring out the opposite action would be, and then doing it. And then continue acting opposite until the emotion goes down. Act it, and just keep doing it over and over. Repeat opposite action over and over every chance you can. Um, so, yeah, we're going to go over the handouts 11 for figuring out those opposite actions. But I will add a caveat here. If you do this over and over for weeks and months and it isn't going down, then maybe you want to go back to the algorithm and ask yourself, maybe this is a justified emotion and maybe you need to do problem solving. Or acting on that emotion. Okay, but I will say most of the time it's that you need to do it over and over and repeatedly, just like exposure therapy for people with phobias. They just need to do it a certain duration of time um, over time. Okay, so we will move to the actual emotions here. So we've got opposite action for fear that you can go over to help you do your homework here. There's situations that fit the facts for fear, like your life or someone you care about is in danger, your health or someone you care about. There is a threat, your well-being. There's a threat. Opposite action for fear would be doing the opposite of your fearful action. Um, and do what you're afraid of doing over and over. Approach events and tasks rather than avoiding, and people that you're afraid of. Do things yourself to give yourself a sense of control and mastery over your fears. Excuse me. Um, uh, all the way opposite action for fear is to keep your eyes and ears open, focused on the feared event, look around, explore. Um, Take the information in from the situation, don't avoid, and change your posture, keep a confident tone, change your body chemistry. So I won't read all of those, but we've got them for all the universal emotions: anger, disgust, envy, jealousy, love, sadness. So some might be like, what do you do for jealousy? The opposite action would be let go of controlling others or share the things that you're feeling protective with. Um, and envy would be to don't destroy somebody else's, what others people have, or count your blessings. Just concentrate on gratitude and all the things you're thankful for and all the things you do have. Um, and let's see, shame is not hiding, making public personal characteristics about your behavior and repeating that over and over. And self-disclosure, that's the opposite of shame. And self-disclosure is actually the secret to connecting with other people, showing your underbelly. So often that can have profound effects on creating intimacy and connections between people. And guilt, don't apologize, don't try to repair. Um, and make public the things um, that you did that you feel might have violated your own values, and change your body posture. So, for your homework, if you choose to do it, you've got emotion regulation handout 6, which has this whole algorithm where you can put in an emotion that you're having that's unwanted, and you can go through this algorithm to see which strategy to use. So hopefully try one that hopefully will have the opposite action that you can try. And then if you have the opposite action, this walks you through how to do it from step by step with the prompting event, asking whether this is justified, what the action urge is, what the opposite action is, what you actually did, how you did it, and how you felt afterwards. Okay. And then next week or next video, you will learn about problem solving. So that'll be the last of the skills on that directly changing your emotional responses. All right. Well, good luck with all your opposite action. Take good care.